No. Well, hello, everyone. I'm Dr. David Ajibade, and welcome to Your Health in Your Hands. I'm going to start again. Hello, everyone. Welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Remember, we've been mandated by the federal government of Nigeria to, amongst other things, provide healthcare solutions to medically fragile children, children with genetic disorders, children with brain disorders, and of course, sickle cell disease. Every Friday, just as a reminder, we have a free clinic from 10 a.m. to 2 p.m. every single Friday, where you can go there and you can collect your medications and nutrients that help to helping your child's hopeful recovery. So just you can go to our website and find out about that. Now, we are still in the COVID-19 season, and there are, as you remember, we had a talk by Dr. Shrivastava, who talked about what's called stem cells and how stem cells can help in the process of recovery from COVID-19. And as you know, we are always focused on the most basic, the most fundamental solutions. So while that is important, and if you can access that, that would be great. But the truth is, we don't always have access to those kind of solutions in Nigeria and other parts of Africa. What we do have access to, which we'll be talking about in the subsequent few minutes and probably an hour, are things like vitamin C and how it can be used in certain conditions. Our guest today, and I'm really honored and privileged to have him on, is Dr. Fowler, and he'll be talking about the relationship between sepsis and pulmonary disorders. And of course, we'll be talking about how that can be applied in COVID-19. So without much further ado, I'm going to say hello, Dr. Fowler. Welcome to the show.
And thank you very much for the invitation. My name is Alpha Fowler. I am a professor of medicine at Virginia Commonwealth University in Richmond, Virginia. And my colleagues and I have been studying vitamin C as a therapy for sepsis and acute lung injury now for approximately 15 years. And we have done some major national trials using vitamin C in patients with acute lung injury that has occurred from sepsis and the viral illness that's producing respiratory failure around the world, and that unfortunately is taking too many lives from us, is very similar to a problem that we've confronted for 100 years in the intensive care unit called acute respiratory distress syndrome. We abbreviate that as ARDS, and we've tried for years to come up with a solution and a therapy to be able to save lives. And not until we did this recent phase 2 multi-center trial using very high doses of vitamin C were we able to show that vitamin C can save lives. This is in patients with bacterial and viral sepsis who have acute lung injury, and it may be very relevant to treatment of COVID pneumonia patients who act very, very similar to patients with bacterial generated ARDS.
But so, Doc, if I may jump in here, you're talking about sepsis and how it affects the lung. But with COVID-19, we're talking about an initial lung disorder, which becomes systemic and probably septic. So it's almost like the reverse of what you're talking about now. How do we reconcile the two?
Well, viremia, which is the SARS-CoV-2 virus, produces a syndrome very similar to bacterial sepsis. And there are many disease processes that will produce acute lung injury, including viremia. And so in situations such as COVID-19, whether it's primary infection with the virus leading to lung injury, or whether it's the virus leading to a secondary bacterial infection and sepsis leading to lung injury. Vitamin C would make sense in all of those instances.
And you're going to explain to us how exactly that can work, because I remember I watched some of your videos online, and I posted on my platform, our old school association, medical school association platform, and they couldn't believe it. They're like, that's ridiculous. There's no way vitamin C, something as simple as vitamin C, can actually have any effect on sepsis or ARDS.
Well, let me say this. Vitamin C, when you give it in extremely high concentrations intravenously, vitamin C becomes an interventional drug. It is potently anti-inflammatory. It calms the inflammatory system in many different respects that I'll go into in just a few minutes with my remarks. But vitamin C is very different when you're giving 15 to 20 grams of it intravenously over a 24-hour period. And I will show you some of our results.
All right. So would you like me to let you share your screen?
Yes, let me share my screen.
All right. I got to tell you, 15 to 20 grams will be scary to a lot of doctors.
All right, wait a minute. Let me bring up my presentation first.
Okay.
All right. Okay. All right, can you see my screen?
Not yet. Did he give you the permission to share it?
Say again.
I'm asking if you've been given permission to share. I'm not seeing your screen. Let me try again. Okay, yeah, you've been given permission to share. Do you have to request? Is there an option saying request?
Oh, it says share. Let me see what happens when I say share.
Bingo. Yep.
All right, but I can't find my presentation. Wait, how about that?
I see it.
You can see it?
Yes, sir.
And how about that?
It's even better. Yeah.
Okay. All right. So this is a presentation that I gave almost a year ago to a long-standing sepsis conference that occurred in the Northwestern United States, but it is very relevant to what we're talking about now. So what I'm going to talk about is a clinical trial that we did that's called vitamin C infusion for treatment in sepsis-induced acute lung injury, and we abbreviated it the CITRIS-ALI trial. So what you have here are two X-rays, and this happens to be an X-ray of an individual with bacterial sepsis-induced acute lung injury. But really, it looks identical to the lung injury in patients with COVID-induced respiratory failure. The important thing about bacterial sepsis is there have been over 5 decades of clinical and basic research that have looked for a solution to saving lives. And despite 50 years of work, effective drug therapy has been elusive until CITRIS-ALI. In the circulation in patients who are septic, and this applies also for COVID sepsis, and we have shown this in COVID sepsis as well, is that in the circulation, low plasma levels of vitamin C, which occur during acute illness, is a constant feature in patients with sepsis. Low levels also of vitamin C give a high incidence of multiple organ failure. And then finally, low levels correlate directly with poor outcome and poor survival. And if you look at the references at the bottom, this dates back all the way to 1996.
Are you going to explain why these low levels, how they relate to all these different things you just pointed out?
Yes, let's go through this.
Okay.
The question we asked, could vitamin C repletion alter the outcome of patients with sepsis-induced acute lung injury or ARDS? So when vitamin C is infused intravenously into the circulation, it immediately binds to a receptor population that's on all vascular endothelium. And the receptor itself literally vacuums vitamin C out of the circulation and transports it across endothelium. It then binds to another receptor on the alveolar lining cells called alveolar epithelium and pumps it directly into the alveolar space. So the important feature of this is vitamin C is a micronutrient. It's not a protein. It's a micronutrient that when it is infused into the bloodstream, it immediately gets transported into where it's needed in the alveolar space.
And the alveoli are the air sacs in the lungs.
Exactly. And so what you have here is a single alveolus and a capillary running by the alveolus. And what we have known for many years now is that the pink cells, which are blood neutrophils become trapped in the capillaries around the alveoli and very rapidly are transported into the lung where they create damage. And what happens is this barrier between air and blood gets broken and blood and plasma floods into the airspace here, showing you basically the yellow is plasma flooding into the airspace and basically drowning the patient. When we infuse vitamin C, the idea is to get the vitamin C into the alveolar space where all these cells are to basically calm down the inflammatory response. In preliminary studies that we conducted, we showed we developed a mouse model of lung injury due to bacterial sepsis. And we showed that vitamin C could reduce the amount of inflammatory proteins that are in the lung and in the bloodstream called cytokines and chemokines. We also showed, like I showed you right here, that in this model, vitamin C would reduce this neutrophil infiltration into the lung. Vitamin C would also reduce what is called neutrophil extracellular trap formation. Because when neutrophils make their way into the alveolus, what you see here is the neutrophil exploding and it disgorges its DNA with all of the enzyme systems which are activated, and it wreaks havoc in the alveolar space. And we showed very clearly that vitamin C would reduce neutrophil extracellular trap formation. It's abbreviated NET or NET formation. The other thing too is that this is very important. Critical care doctors who are struggling with patients with lungs full of fluid are just ventilating them for days or sometimes weeks. And we have to have a way of clearing that fluid out of the airspace. And we showed in our animal model that vitamin C would dramatically clear alveolar fluid from the alveolar space where all the air is. And we also showed that vitamin C would enhance the barrier function between air and blood in the lung. We then went on.
If I may just jump in here. If I may?
Yes.
So the one that makes the most sense to the, let's say the newbie, the person who has never really studied this, is the barrier function, because we know vitamin C is very important in collagen formation and in the integrity of walls and in endothelial cells and everything like that. But what you're showing me here, or what we're seeing here, is that all these four things that it does, these are all things that are caused by the body, the human body's response. I don't see anything about sepsis or the virus. So basically you're saying that all this damage and problems that are in the lungs are because of what we are doing to ourselves?
Perfect. perfect description because you can look at sepsis like throwing gasoline on a fire. It ignites the body's immune system, and the body's immune system spirals out of control. And what vitamin C is doing is interrupting that spiral.
Interesting. Please proceed.
So we then moved to a small trial of patients with sepsis in our intensive care unit here at Virginia Commonwealth University. And what we showed was that if we give high doses of vitamin C every 6 hours for 96 hours, that we could reduce organ failure. And what you see, this abbreviation, SOFA, stands for Sequential Organ Failure Assessment Score.
Right.
And we also decreased some proteins indicating inflammation.
Right.
We then took it to a phase 2 trial, multi-center, 7 enrollment sites, so-called phase 2A multi-center trial. And this was a proof of concept trial, randomized controlled trial that was double blind. So nobody knew what the patient was receiving. We were looking for efficacy of physiological variables as well as biochemical endpoints, not clinical endpoints. We were working with well-characterized patients with sepsis. We were working.
What does well-characterized patients mean?
Well-characterized patients with sepsis and acute lung injury.
What does that mean?
That's what the NIH wanted. The NIH gave this program out called the UM1, and they were looking for treatment on well-characterized subjects, bacterial sepsis, acute lung injury. They were looking for a novel immunomodulating therapy for acute lung injury and a common drug with low toxicity.
Vitamin C does that. Doc, just a quick minute. We have to take a short break. I almost forgot. We should have a short break at this point. So folks, don't go away. We will be right back. This fascinating study. Love your slides, Doc. Love your slides. Fantastic. Very, very clear, very sharp. Okay. All right. So we're back now.
Okay. So the way this got started.
Let me just say quickly. Welcome back. We are continuing our study with Dr. Fowler, who is a professor from the Virginia Commonwealth University, talking about his study with vitamin C and sepsis and its effect on the lungs. Please go ahead, Doc.
Okay. So the National Heart, Lung, and Blood Institute in the US put out this request for proposals. We submitted a proposal and got funded for $3.2 million to do a 7-center trial.
Wow.
And this multi-center trial was conducted at Virginia Commonwealth University, at the Cleveland Clinic in Cleveland, Ohio, as well as a large medical center in Cleveland called the Fairview Medical Center. It was conducted in Milwaukee, Wisconsin at the Medical College of Wisconsin, and another large medical center, St. Luke's Medical Center, also at the University of Kentucky and Lexington, Kentucky, and at Emory University in Atlanta, Georgia. And we enroll patients at those sites. What we had proposed to the NIH is we would look at the sequential organ failure assessment score between 0 and 96 hours, that we would look at plasma C-reactive protein and thrombomodulin, and we were interested in ventilator-free days in patients with respiratory failure, intensive care unit-free days, how quick did patients get out of the ICU, hospital-free days out 2 months from the onset of the study. And then finally, we were very importantly interested in all-cause mortality, basically at 1 month after the onset of the illness. People were included in this study And again, you can think about COVID pneumonia as well while we're talking about this.
Mhm.
Patients with severe bacterial and viral sepsis, patients who had ARDS, acute respiratory distress syndrome, and we used an oxygenation criteria to permit patients to come in the trial, which basically is patients weren't enrolled until they had serious acute lung injury and respiratory failure. Patients had to be on a mechanical ventilator with an air tube in place. They had to have chest imaging, which showed bilateral opacities, like I showed you at the beginning of this talk.
Right.
They had to have met ARDS criteria, and it had to have been met within 24 hours.
Mm.
And there could be no evidence of heart failure.
So basically what you're saying here is that these patients were already in the hospital.
They were in intensive care.
They were already into intensive care, and then you waited until they met certain criteria before your intervention. Is that what you're saying?
Exactly.
Okay.
We excluded people who had an allergy to vitamin C. We did have a couple of people. If we were unable to obtain informed consent, if it was greater than 48 hours since meeting the ARDS criteria, and this virtually always occurred if we could not obtain informed consent.
Got it.
Because many people for Virginia Commonwealth University, families live 2 or 3, sometimes more hours away. And we had trouble finding family members to give consent. Pregnant women were excluded. If patients were on home mechanical ventilation, which is relatively common in the US, patients who were not expected to survive, perhaps, for example, with widely metastatic cancer. And then finally, patients who were wards of the state, who were basically prisoners. We could not experiment, quote unquote, on prisoners.
Okay.
So we screened 1,262 patients, and we had a number of exclusion criteria, and we ended up excluding 1,092 patients, all the way down to excellently described 170 patients who were randomized. And what I mean by randomized, they either were going to be assigned to get vitamin C or they were assigned to placebo, which was just the ICU standard of care. And the patients who ended up in the vitamin C group also just received standard of care, except they were receiving vitamin C. And after we randomized in the placebo group, which was 83 patients, we found one patient with acute eosinophilic pneumonia, which occurs and looks like ARDS, but it was not bacterially produced ARDS. And in the vitamin C group, we had 2 patients with severe leukemia who were in respiratory failure because their lungs were hemorrhaging. And so we excluded those 2 patients, so-called alveolar hemorrhage.
I see.
And so what we ended up with was 83 placebo and 84 patients in vitamin C. And in the vitamin C group, we scheduled patients to receive 50 milligrams per kilogram of body weight infused over 30 minutes every 6 hours for 96 hours. And we reported this in 2019 in the Journal of the American Medical Association.
Isn't that one of the most prestigious journals in the United States?
JAMA is one of the most popular journals read worldwide. And it has a distinction in being one of the highest read journals on the planet.
Wow.
I will say this, it took an entire year for them to accept this paper. We had to go over, around and around. It's an incredible journal, but we had to do due diligence to get it accepted to JAMA.
That is impressive, because I know that, I mean, especially for simple nutrients, there'll be a lot of scrutiny to ensure that this is correct science, right? Doc,
I will tell you, when they did their first review, I sent the manuscript to them in August of 2018. And it took them 4 months to get back to me with a 30-page document with almost 100 items they wanted addressed. Anyway, it's all history now.
My goodness. Doc, I'm going to have to take the screen back at this point briefly. Hang on just a minute, if I may.
Sure, go ahead. Questions?
I'm going to need you to let me take your screen back.
Oh, you want me to unshare?
Yes, please.
Okay. Do you have it now?
I do not.
Well,
Okay.
I'm sorry.
Okay, I think I got it. I think I got it.
Let me know when you want me to. Oh, there you go.
Okay. All right. Hang on. Oof. I think this is what we're. Okay, hang on. Controls. Hang on. Not the best at this thing either. So. Okay. Are you seeing my screen or your screen, Doc?
I see Zoom, join a meeting, sign in.
Okay. What I'm trying to do is I'm trying to get it back to full screen, so it shows both of us side by side. Let me see what we can do.
I think I might be able to help you with that. Sign me back in.
Okay. I'm still trying. Sorry, this is new for me. Okay, I'm going to stop share. Okay, that's what I wanted to do. We're back, Doc. So, folks, so at this point, we need to break it because this is kind of like gone past the time for the 25-minute thing. We're going to break it and we're going to continue in the next session. So just so I can give them a clean recording. So I'm just going to end this segment here, and then we're going to start over with another one if that's okay. All right. Well, folks, that's all we have for now. Please join us next week as we go over Dr. Fowler's fascinating study. Now, remember, this is novel, and I like one of the things that the criteria the government was asking for. It has to be safe. The intervention has to be safe. It has to be non-toxic. It has to be easily usable. And I think that's perfectly, like I said at the beginning, what we need in Africa and other third world countries are simple solutions that do not require as high-tech equipment, because we don't have access to those equipment. And of course, we don't have access as much to specialists either. So I think this is super important. I think that our healthcare professionals really should pay attention to this, because COVID-19 is just one of many things that will be affecting us in the years to come. So please stay tuned. Make sure you invite your healthcare providers, your doctors, to watch this. The recordings are on our website, brainandbodyfoundation.org, on the NTA Network's website as well. And of course, you can go onto YouTube as well. So God bless, stay safe, and we will see you again next week. Thank you so much again, Dr. Fowler. All right, see you guys next week. Bye. Okay, I'm going to end this, Doc. No, we're still on it. I think we can continue with this. I don't want to mess up with whatever settings we have, and I certainly don't want to send you another email. I do not want to send you an email, that's for sure. Can you tilt your camera downwards a little bit? Let's cut the space above your head by 3/4. Is that possible?
This?
Okay, just a little bit more. Okay, perfect. I love it. Much better. Okay. All right, so I'm going to do another quick introduction, and then we'll get right back into it. Okay. Still recording? Okay. Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. As part of our mandate from the federal government of Nigeria, we We are to provide you with information and education, not just for the lay people, but for healthcare professionals as well. Part of our mandate is actually to teach in healthcare in training schools for doctors, pharmacists, nurses, as well as for the public, because there's still a lot of education that we really feel needs to be gotten out. And we've been privileged to have partners and friends and people in the US and other parts of the world who are willing to share their information, share their research findings, share their discoveries with us. And we are passing it on to you. And of course, one of them is someone I've come to respect a great deal, Professor Fowler, actually, of the Virginia Commonwealth University. And if you were on last week, you remember he was talking about the fascinating study into how vitamin C can work effectively in the treatment. Remember, I used the word treatment of ARDS, which is acute respiratory distress syndrome as a result of sepsis. Now, what you say, what does that have to do with COVID-19? Well, it has a lot to do with COVID-19. It's because COVID-19 primarily affects the lungs. And as Dr. Fowler said last week, the findings in the lungs are very similar to the findings as a result of sepsis, which is when there's infection all over the body and it's causing organ failure. So it's almost like a reverse of what happens with COVID-19. In COVID-19, the virus attacks the lungs, and from the lungs, there's sepsis and there's all kinds of damage to the rest of the body. And what Dr. Fowler is talking about is there's sepsis around the body, there's infection, there's damage to the organs, which includes the lungs. But the process is still the same. Bottom line is that vitamin C can play a significant role in the treatment of lung disease and therefore can save lives, which is what everyone is after. It's the saving of lives in the simplest, safest possible way. So Dr. Fowler, thank you again for taking the time.
Glad to.
So as we were saying, I'm going to hand this back to your screen so that we can continue with our discussion. So let me do that. Hang on just a minute.
That's not going to do it.
Okay, try again.
How about now? You say it?
Not yet. So in about 7 minutes time or 10 minutes time, I'll do a quick short break. But are you getting?
I'm having trouble bringing it back up.
Okay.
Here, let me. All right, can you try to get that?
You want to take it back or?
It's just I've opened the program.
Yeah, I'm going to take it back. Let's see, maybe that might unhinge it.
All right.
And it's back to you now.
It's not working.
Okay.
I mean, I have the slides are right here.
Does it not give you a request to share?
Yeah, it does, but how about that?
Yes, sir.
Okay. All right. And so let me get.
If you may just do a quick recap of some of the things you're talking about, just to catch people up to speed.
Okay, go ahead.
No, I'm asking you to do that.
Okay, and as you know, when we were speaking last week, we showed this slide, which was meant to show how we enrolled patients into the study. 83 patients who were placebo standard of care patients, and 84 patients who received vitamin C and also standard of care. And our dosing scheme is listed here, which means that an adult in an intensive care unit would receive about 3,500 milligrams intravenously every 6 hours for 96 hours. Here is the effect on plasma. And what we see here, this is baseline. And when vitamin C was infused, we could achieve very high levels that were about 1,000 times higher than the normal plasma level. But the important thing about sepsis, you see this orange dotted line, the important thing about bacterial sepsis as well as COVID sepsis is that baseline vitamin C levels are low, and these are critically low vitamin C levels. And you can see the effect of our infusion over a 4-day period. And then even at 168 hours, which was day 7, we still were able to achieve levels of vitamin C that were above that in the placebo patients.
Just a quick one, Doc. So if we may go back to that slide, just for our uninitiated viewers, baseline for vitamin C would be what?
70 micromolar in the circulation. And you see the dotted line, this is 20 micromolar. And so these levels are seriously low. They're at the level of what you would call scurvy.
Interesting. And that's as a result of the sepsis. So it does make sense to take care of that, to replete that, even if it doesn't go as high as this. So basically, if I may just jump in here, if anybody's going through any kind of sepsis and who may not have access to vitamin C infusion, is there the possibility, and I don't want to put you on the spot here, of them, would you advise them to take vitamin C powder if they're in some kind of respiratory distress problems?
That's a great question. And the answer to that is it's been very carefully studied. You cannot take enough vitamin C through your GI tract to achieve levels like I'm showing here.
Okay.
It has to be given intravenously. Now, having said that, if you have a high diet concentration, like taking medications orally of vitamin C, you can achieve a plasma level of about 120 micromolar, which is about 2 times normal, but nothing like what I'm showing here.
Got it. Okay.
And so, as I mentioned, we used the sequential organ failure assessment score, which measures 6 different organs: brain, it measures the extent of respiratory failure, liver function failure, bone marrow failure, renal failure, and shock. The one thing about our study, the clinicians that were involved in the study did not draw enough hepatic function studies for us to make sense of vitamin C's effect on the liver. So we called it the modified sequential organ failure assessment score. All of our other organs were analyzed.
And these are all organs that are affected in COVID-19, yes?
Exactly, just as in bacterial sepsis.
Okay.
When we performed our initial analysis of the organ failure score, we did not account for the people who had died and had analyzed their organ failure. And so what we reported initially was a survivorship bias, because we only analyzed the organ failure scores in the people who had survived, which was wrong. And in the aftermath of publishing the JAMA publication, we received a ton of letters telling us we had analyzed it wrong. And I'll show you the reanalysis in a couple of slides. We analyzed C-reactive protein, which we did not find a difference. We analyzed the protein thrombomodulin, which we didn't find made a difference. But in the aftermath of this, we analyzed 2 additional features of the inflammatory response. If you remember how I mentioned NETs, neutrophil extracellular trap formation, when that happens, it releases a lot of DNA into the circulation, free DNA. And we analyzed the free DNA and found that vitamin C dramatically lowered the free DNA. And free DNA has been studied over the years, and the higher your free DNA level, the higher the chance you're going to die in bacterial sepsis. And we showed that vitamin C dramatically reduced the free DNA level. And another protein called syndecan-1, which is a protein that lines the surface of the blood vessels and it breaks up and is released into the circulation in high numbers when you're septic. And we showed vitamin C also reduced that level as well.
Interesting. Folks, we're going to take a quick break here. Don't go away. All right, we're back with Dr. Fowler and his study on vitamin C and sepsis. Please go ahead, Doc.
Okay. So as I'd mentioned last week, we were looking at ventilator-free days, which was how quick could a patient get off being on the ventilator when they were treated with vitamin C. And what you see here on the left is the vitamin C patients. And there was a strong trend towards getting people off the ventilator earlier, but you can see up here, it didn't quite reach statistical significance.
Okay.
Importantly, however, we showed that vitamin C would make patients get better to the effect that they could get out of the ICU earlier. And we looked at intensive care unit free days over the 28-day period and found patients treated with vitamin C got out of the ICU faster. And in the United States, the average day in the intensive care unit is about $40,000. And so by getting people out of ICU earlier, it also helped with cost of medical care.
Interesting. Doc, quick one. What's your impression? What do you want to say a few things about ventilator use and ARDS, or whether in COVID-19 or sepsis?
It's complicated, highly technical. Ventilating people in acute respiratory failure, either with sepsis-induced acute respiratory failure or now COVID-induced respiratory failure, it's very complicated. It can extend out to sometimes as long as 2 or 3 weeks. And so if we apply vitamin C in a way that I'm listing here, we may be able to get people off mechanical ventilation earlier simply by reducing the inflammation in the lung.
So the key is inflammation.
Inflammation in the lung. So
just in case, especially again in third world countries like ours, where the ventilators aren't as available, there may be a case for healthcare professionals using IV vitamin C to help to reduce the inflammation, because ventilators aren't going to be able to do that, right?
Ventilators whether it's what we call invasive mechanical ventilation, where you actually put an airway tube in, or whether you're doing face mask ventilation in somebody who's marginal and it can receive face mask ventilation, you want to get them off mechanical ventilation as quickly as possible.
Okay. That says a lot of things, Doc, but I'm not going to press you on that.
All right. So what you see here, we showed that vitamin C significantly increased the number of hospital-free days out to day 60, which is very important.
Yeah, for financial reasons as well as for health reasons.
So what I'm showing you here is the effect of vitamin C. This is a survival curve. And what you see here, I'd like to, first of all, look at this orange column. And the blue are the placebo patients. And this is mortality. Look how fast the untreated patients were dying in the first 4 days compared to vitamin C.
Wow, wow, wow.
19 patients died in the placebo group versus only 4 patients who died in the vitamin C treatment group. This is what is called a Kaplan-Meier survival curve. And you can see that once patients come off of vitamin C, there's kind of a similar trajectory in these lines. But by the end of day 28, we found that the placebo mortality was 46% versus the placebo mortality in the vitamin C patients of 30%. And this was highly significant.
Definitely. Wow. Wow. So the treatment period was only 4 days, just to recap. Only 4 days.
96 hours.
And after that, they were left to themselves.
Right,
Regulatory.
exactly.
Okay.
And so I wanted to show this in that after we published in JAMA, we received a number of letters telling us that we had applied the wrong analysis on on the organ failure scores. And so what we had reported was a survivorship bias. But when we included the organ failure of the people who died, look at the effect of vitamin C on organ failure. It was highly significant at p less than 0.026. So vitamin C not only saved lives, but it also, in the people who made it through this course, it improved organ failure significantly.
So the lower the score, the better the
Exactly. The lower the score, the better.
Fantastic. Fantastic.
So I'll stop here by saying this, because I think this is what you really wanted to talk about. High dose intravenous vitamin C is extremely safe in people who are critically ill. It does not reduce the blood pressure. If anything, it improves blood pressure, because as you give high dose vitamin C, it helps the body to synthesize the hormone that helps control the blood pressure called norepinephrine. We found that when we had reported on survivors, there was no difference. But when we reported on non-survivors, the organ failure score was significantly lowered by vitamin C. We found significant treatment effects on ICU-free days. That's important. Hospital-free days. That's important. And this is the wishing well that has been worked at for 50 years. What can we do to save lives? And we showed that a simple concoction would bring down the 28-day mortality. And when we adjusted for mortality, we also showed vitamin C improved organ failure.
That is significant.
It's important for me to show this last slide in that this was an example of team science, because you see the team here listed in front of you: physicians, critical care nurses, hospital administrators that let us proceed in these different medical centers, support from the National Institutes of Health, support from a large clinical research center on the VCU campus. And very importantly, I guess the last thing that we should talk about is the supplier of the vitamin C. This is McGuff Pharmaceuticals. They supply vitamin C worldwide, and it can be easily obtained in Africa. We are beginning a trial in Rwanda in septic patients. You may have heard about that trial that's about to begin.
Yes, I have.
But McGuff, I've been working with them now for 10 years. They supply vitamin C to the world.
Wow.
And vitamin C, it comes in 50 milliliter vials. It's about $90 to $100 per vial, compared to one injection of an expensive antibiotic in an ICU could be $1,200 or $1,300.
Wow.
So cost of care, not only in drug administration, but cost of care in people surviving, getting out of ICU earlier, staying out of hospital more frequently.
Wow. Doc, let me take this back from you, but this is life-changing, I have to say. Hang on, this man. Maybe you need to hand this back. Yes, thank you. Got it back. My screen.
You got it?
I have. Then stop share. Got it. Okay. we have only a few minutes left, so I'm going to wrap up. Folks, this is revolutionary, and I think this is so important for this to be shared. Again, not just with your friends and family, but also with your healthcare professionals. And those of you who know people in government and other governments in Africa, you need to share this video. This is really, really important, and it can save a lot of lives. And I remember when I was watching, I first came across the Dr. Fowler's video on YouTube. I was going for a walk in Abuja, the Jabi Park, and of course with kids, everybody running by and so much noise and all that. But when he started saying the things he was saying, I remember stopping dead in my tracks and looking at his slides and thinking to myself, how can this man be saying all this and still be employed in a very fantastic institution? Because I know of other people who had mentioned some things about vitamin C and they had been ostracized. But here he was showing hardcore data and showing that vitamin C could treat a disease that currently has, what's the failure rate, Doc? The failure rates.
Well, if you just look at the figures from our trial, patients who were treated with standard of care who had sepsis and ARDS had a 47% chance of dying.
That's almost 50%. Once they get into
almost half the patients died.
And now we're seeing the possibility of what's the rates now? The possibility.
Well, we've dropped it to 28. Well, actually, it was 28.8%, but I just reported it as 30. But I think the thing that I would emphasize to your viewers is this trial was conducted in some of the United States' best intensive care units. The Cleveland Clinic, Virginia Commonwealth University, Medical College of Wisconsin, University of Kentucky, Emory University, Atlanta. These are all institutions that have highly technical support and learning for supporting people with not only with organ failure, but respiratory failure, and are prepared to support them for as long as it takes. Right.
So point taken is that this is not in any run-of-the-mill kind of healthcare center.
Exactly.
Okay. But still, the point still is that there is some possibility of survival if vitamin C is added to the regimen, whatever it may be.
Yes, to a regimen of good ventilator care, to antibiotic care. In the case of COVID, probably remdesivir being used when it can be obtained. There are small trials that are going on with different monoclonal antibodies to various structures on the virus. But the thing about vitamin C, it can be deployed easily without worrying about any side effect.
That is huge. That's absolutely important. All right, thank you. And by the way, we're getting the head of the project, the remdesivir project, from Gilead Pharmaceuticals.
Good. That's good.
We'll be on to do a presentation. We actually went to medical school together. So.
Oh, excellent.
Yes. So looking forward to that. Thank you so much again, Dr. Fowler.
I'm so glad to be with you.
I really appreciate it. Any final words? Final?
My final words are, I'm so broken up about all the death that this pandemic has caused. In the United States, we're close to 500,000 people have died. Mm-hmm. I personally have had patients who have died. I have had relatives who have died. My wife and I have two girls, and they're almost 40 years old. And in the younger years, when we were participating in travel soccer for the girls, we got to be friends with some of the parents that were standing on the sidelines with us. And we know that 2 of those parents that we knew for those years have died from COVID pneumonia.
Oh, no.
So hopefully your viewers can begin to think about incorporating vitamin C in their treatment regimens. McGuff Pharmaceuticals in Santa Ana, California is easy to contact. And as I had mentioned earlier, they ship vitamin C globally, and give it a try. There's nothing to lose.
Well said, Doc. Thank you so much again. Well, folks, please remember, these videos are available on our site and on the National Television Authority site, NTA site as well. So please, Nigerian Television Authority, I should say. But please access them and share them with others. God bless you, stay safe, and see you again next week. Bye. Awesome, Doc. Let me just stop the recording.